I'm Elaine Hammond. I'm your semi-fearless moderator for the next little bit of time. I come to us courtesy of the School of Social Work, where my teaching and practice are actually in contemplative pedagogies and contemplative work with clients who experience trauma. And I'm really happy to be here today. I can't even begin to tell you how happy I am to be here today. It is a joyful day, and the fulfillment of a lot of people's dreams and aspirations for this many people to be able to come together and discuss. So what we're going to do in this panel will be a little bit different than originally planned, but mostly on the kinds of things that I would say. So I will not talk a whole lot, and that'll be good. I will skip most of the introductions of our speakers. Their biographies are found in your conference program, so you can take a look at that. Each speaker will present. We'll begin with Dr. Epstein, then we'll move to Dr. Cook-Cottone, and then finally our very brave students who are here to talk about their experiences with both contemplative pedagogy in the classroom and how it's beginning to prepare them for their professions. And then we'll have opportunity for questions and answers. Again, as in this morning, there will be people with microphones because it's more difficult to hear, that, especially up here, than you might think that it would be. So it really is helpful if you can raise your hand and make sure that you get a microphone from one of our volunteers in the aisles when the time comes. And in the spirit of the process and the spirit of the day, let's take a moment again to take a breath. Breathing in through the nose and out through the mouth, over the lips, as if you are blowing out the candles on a cake and you are very, very old. And laughter is good as well. And a second breath. And third. So welcome. We're going to spend the next little bit of time talking about how we might begin to use contemplative measures in the classroom, in clinical preparation practice, and as a mechanism for what Daniel referred to as sustaining students once they leave and enter the profession. We're going to begin with Dr. Epstein, who comes to us from the University of Rochester School of Medicine and Dentistry.
Good morning. I'm a family doctor and I also do palliative care. And I just wanted to start out by saying that even though you think that because doctors are dealing with life and death all the time, that medicine itself would be a self-reflective practice. But I didn't find much of that when I was a medical student. There was research on meditation and blood pressure and other aspects of health, but very little attention to the practitioner, him or herself. And over the past 30 years, that's really been the focus of my work, is to help clinicians themselves become more mindful. So, is this working? Can we advance the slide? I'll just do it here. So I'd like you to imagine for a moment. Let's say you went to bed tonight and woke tomorrow to find that the healthcare system and the total organization of healthcare in this country were transformed. And let's say you had a serious health concern, something that was really worrying you a lot. And you call the office and you're amazed that your doctor actually can see you within an hour or two. When you arrive, the staff is attentive and courteous and they know you. You're astounded at the care you receive. Not only is it technically proficient, but your clinicians are really alert to your concerns and they're interested in who you are as a person, your work, your home life, what's really important to you. I did take my medicine this morning, by the way. They help you make decisions, not only guided by the latest research, but also by your personal values and your own clinical situation. You know that the doctors and nurses and health professionals are talking to one another, anticipating your needs. Safety checks are in place so mistakes don't happen, and if they do, they're rapidly corrected and you get a full explanation. Your care is efficient, cost-effective, and it works. Imagine that your doctor is busy but really has the time to listen to your concerns. She doesn't interrupt you, you feel cared for as a person. You're not just merely a case or a problem to be solved. Your healthcare team provides you information and support. You have a voice in the aspects of healthcare that matter to you, and your time isn't wasted with bureaucratic and administrative hassles. Imagine that your doctor feels a sense of meaning in her work. Her work is difficult, stressful, and demanding, but your doctor has the self-awareness, mindfulness, and resilience to stay on top of things. She finds her relationship with patients to be meaningful and provides some of the sustenance to tolerate the long hours without burning out. She has enough control over the scheduling and organization of her practice so it can really reflect her deepest values. And when dealing with the most difficult moments in medicine, when witnessing unrelieved suffering, when unpacking what might have contributed to an error, when making difficult ethical choices, your doctor feels and knows that there's support from peers and from the institution as a whole. Now, this is what I've been trying to achieve for the past 30 years, and I think in some ways there's been progress. Major healthcare organizations actually share this vision and articulate it. If you read reports by the Institute of Medicine, by the National Cancer Institute, they contain language like this. But I think people don't really know how to make this happen. I mean, you can do some changes in the structuring of healthcare and the financing it. But there's not been a lot of attention paid to the inner lives of those who actually provide that care. So I've tried over time to distill what it is about these inner lives that really makes a difference, and I call it mindful practice. So it's kind of bringing mindfulness to what the Brits call the coal face, to the front line, to that moment when I'm with a patient and that patient's pissed off at me, or I have to tell them they have a cancer that's incurable, or congratulate them on the birth of their child. I mean, all of these incredibly intense emotional moments that really require that I bring all that I can be to healthcare. So mindfulness is a vector in that setting. It's not something that's static. It actually has a purpose. And the purpose is clarity and compassion. And how you get there is through awareness. So the starting points that I've had in the work that I do is that well-being is about engagement, not withdrawal. So Daniel, when he wanted to run off the stage before, actually ultimately wouldn't have given him a sense of well-being. What really gave him that sense of well-being was the ability to sustain attention with the audience, even though it was pretty scary to do so. The second starting point is that mental stability can actually be cultivated. And this was actually a radical notion for psychologists as recently as 30 years ago. It was thought that by the time you got to be an adult, you had whatever mental resources you could ever have. And that was it. It was very deterministic. And we're learning otherwise, and we'll hear why that's the case a little bit later today. The third starting point is that the self is illusory. It's something that we're constantly constructing, which means that we can change it. And the fourth is that mindfulness is a community activity. I was traveling in the Himalayas a number of years ago and noticed that there were these refuges way up in the mountains, hermitages, where people would stay and do retreats of 3 years at a time without seeing another human being. And I asked the locals, like, how do people actually sustain that? And the answer is because they know there are other monks and other hermitages, and the villagers bring them food. And it's part of a cosmology and a community that really supports their efforts. And so none of us can do this alone. Absolutely none of us. So the first principle and I try to still think this in kind of simple ideas. The first is attention. And attention really consists of two aspects. That is how you regulate your attention, how you focus your attention or maintain a kind of open awareness, but also what you choose to attend to. Now, in medical training, we are tacitly guided towards paying attention to certain kinds of things and not to others. I do a lot of audio recordings of conversations between doctors and patients as part of my research. And I find it's extraordinary that a patient will talk about their chest pain to their cardiologist, and the cardiologist will ask all sorts of questions about the nature of that pain, but then the patient will say that I'm scared. And somehow those two words, I'm scared, just go like that. It's because there's no way, we're not trained to actually register that's even relevant information. So part of attention is cultivating both the ability to pay attention and also discriminate in terms of what really matters. So what is it that we tend to notice about ourselves, about things, about others? How do we notice? What do we exclude from our field of vision? And how do we choose among competing sources of information? And this is very relevant to day-to-day work. Now, curiosity, let me just give you an example. I have a patient who has muscular dystrophy. He's in his 40s, his muscles gradually are going to get weaker and weaker. Eventually his breathing will fail, eventually he will have an arrhythmia, and he will die from this. In fact, he knows this quite well because his sister died of this about 10 years ago, and his father died of this about 30 years ago. He is quite aware of what's going to happen, and he has to take, I prescribed for him testosterone, steroids, because as you know, steroids build muscles, and what he lacks is muscle strength. But he stopped taking his steroids about a year ago. He just didn't really feel much motivation to do so. And last month he came in and said, told me he'd started taking his steroids again. Now I could have said, oh great, and moved on to the next thing, but I decided to ask why. And he said, that he had a girlfriend. And he said, just in case. And it was very sweet. It was kind of a poignant moment, but clearly that recognition of his humanity is going to enable him to care for himself better, whereas previously he hadn't been. Just this little moment of curiosity. I call that a mindful moment in practice. As a family physician, I see patients over time, and some of my patients I've taken care of for over 30 years. And some of them come in every single time I see them with exactly the same concerns and complaints, over and over and over and over and over again. So much so that I kind of can begin to assume that the next visit, that they'll say exactly the same thing. But as I've learned, sometimes someone who has for example, chronic headaches that for whatever reason haven't ever gone away, might look a little different or feel a little different this time. And I might notice that their face is a little more sallow, that they've lost weight, that their clothes are a little looser. That might prompt me to examine their belly and listen to their chest in a way that I hadn't before. And that's what distinguishes a good family physician from just kind of an ordinary family physician. It's that ability to set aside what's happened before, to set aside what my presumed expertise about this person, so that I can see this person afresh each time. That particular patient ended up having ovarian cancer, which fortunately proved to be treatable. But had it not been that ability to approach her with a beginner's mind, I would have totally missed that. So it has to do with what's going on inside me. And finally, there's this elusive thing that we call presence. Patients know when you're present and can say that you're really there for them. But I've tried to unpack what that is. And presence means that when there's emotional valence to a discussion, that you're not thrown off kilter, that you kind of stay on your surfboard. You know, you kind of you don't get knocked over by the wave. That you remain emotionally engaged. That you can turn towards that dissonance rather than away from it. A surgeon colleague of mine calls it slowing down when you should. She's observed surgeons in the operating room, those who are really good surgeons, can just detect these slowing down moments a split second before their colleague, before they cut into something that they shouldn't or move too quickly. And finally, maintaining a non-referential compassion, that it's very easy to be compassionate in medicine towards people who you feel aren't to blame for their suffering, or people who are kind of like you in some way. But being compassionate towards the person who yells at you, or the person who comes in completely unwashed and you can't stand the stench. Though that kind of compassion, I think, takes a bit more introspection, a bit more work. So I'm going to probably go over things that probably seem self-evident to you, but not to every doctor, which is that the quality of care that you bring to a patient is related to the quality of caring, that is your emotional engagement, as well as your own sense of resilience and well-being. And there's a body of research now that actually establishes this over and over and over again, that clinicians who are feeling well generally provide better care. I mean, it seems self-evident, but in medicine, suffering it's kind of presumed that as a clinician, you need to suffer. I mean, it's a very other-oriented specialty, and taking care of yourself is actually not part of the culture of medicine. Even though the public thinks about golf on Wednesdays, that's really not part of the culture when you're in the hospital, when you're in the clinic. And this thing we call mindful practice would hopefully contribute to all three of those aspects. There's a huge literature on why clinician distress matters. I'm not going to go through that, but it clear links with lower quality of care, poorer relationships, worse safety, more professional breaches of professionalism. And also, when physicians go part-time or they quit practice, it costs the system enormous amounts of money. Currently about $300,000 or $400,000 to replace a physician just in recruitment costs and training costs when people start. So it's expensive. So what do we do? So Mick Krasner, who's here, will be talking this afternoon. Will probably fill in some of the gaps that I can't in a brief talk here. But we've tried to engage physicians in a program that we call Mindful Practice, and we've done it in a variety of forms. We have part of the required medical school curriculum. Some of the residency programs have sessions about mindfulness. And also we've offered sessions for practitioners, including a year-long format as well as more focused kind of week-long or weekend workshops. And we start, part of the trick has been learning the language. If I showed up in purple robes and had lots of beads and gongs, I wouldn't get very far. So I need to actually join the tribe, if you will. I'm a member of the tribe of family physicians, but I'm not a member of the tribe of surgeons. And medicine is very, very balkanized in that way. So, the presentation really matters. So when introducing formal practice, I'll say, well, do you think that you could possibly sit still and just observe your own mental activity for 30 seconds and see what that's like and report back? So start small. 2 minutes twice daily increases tolerance. I mean, it's kind of a joke, but in a way, it's the language that people... Now, how do you bring this into the practice? Well, most of us go from one room to the next, seeing patients. Well, what do you do during those transitional times? Well, I touch a doorknob or a door handle. Well, what happens when I touch that doorknob? Well, I've trained myself to kind of mentally take a breath, set aside what's just previously happened with that patient, and it might have been a patient I've had to give very bad news to, so that I can now be present with the next patient who might be in a completely different setting. So that moment, that momentary act of mindfulness, in my view, is an ethical act. It's giving that next patient what they deserve. It's part of that dream that I talked about in the beginning. It's part of getting closer to that. And there are other exercises that I won't go into that can be done just as quickly, that help you stabilize your attention and also approach people who might be somewhat different from you or difficult for you. This is something that we do with students and residents and practitioners. It's very easy to identify when you're very stressed, but it's much harder to identify when you're just beginning to get stressed, when you can do more about it. So I asked them just to think about what are some of the earliest warning signs they have of stress. Well, maybe their handwriting deteriorates, or maybe they get a twitch in their shoulder, or maybe they find that they're hungry. I mean, just noticing these and using these as friends, as signals to themselves to say what's going on, what is it about me that might be interfering with my practicing most optimally. Asking reflective questions. What's new or unique about this situation? During flu season, I'll see hundreds of people with the flu, but then there's the one person who might have leukemia. Well, I don't want to miss that one person, so with each person I kind of mentally make this exercise. What's new and unique here? What am I assuming about this patient that might not be true? Or even decentering and saying, what would a trusted peer say? I step outside of myself, I think about my greatest teachers and say, well, they're watching me now, they're looking over my shoulder, and what would they say? And, Ron, you're not quite, look over there, that kind of thing. So we have people write stories. Doctors are full of stories and mostly haven't told them, especially if they're about bad things. If they've made a mistake, or if they felt really awful about a patient's death, or if they feel that they're incompetent in some way. And this sense of imposterism really plagues any professional, but I think in medicine it's particularly rampant because medicine is so inexact and imperfect. So we ask people to write a story about when they had a meaningful experience or a distressing experience. But then the key is how they share those stories. We ask people to listen deeply in the same way that you would listen and observe your own thoughts and feelings during meditation. So this is a paired interpersonal meditation, if you will, the substrate of which is a story, but the learning really is practicing over and over again, lubricating the neural connections that enable you to listen deeply to another person without flinching, without applying judgments, without applying interpretations, but just unflinchingly being there. Now, of course, this translates into clinical practice, because that's what clinical practice demands of us. We use a technique called appreciative inquiry. Those who can't see the slide says, it's always good dog, never great dog. And sometimes we really emphasize that these stories, or sometimes we do them as interviews, be focused on one's positive potential as opposed to things gone wrong. So think about a situation in which there was an error made, but you did something to correct it rapidly. Or think about a situation in which you really made a difference. So as to not only be aware of where you fall short, but also what your positive potential might be. We actually studied this with a group of 70 primary care physicians. I'm not going to go into this in detail. It was published in JAMA in 2009 with Nick being the first author of that. But we found that it made a difference, that doctors felt less burned out, they were more empathic, they were more interested in patients as people, and these effects actually persisted beyond the year-long course that they participated in. And one thing that we found was their personalities actually changed, that they were able to be more mentally stable, they were less distressed by negative emotion. And the second was that they were more attentive, and these are measured on standard personality scales, the Neo-5 factor. So we actually accomplished something, and these physicians were in their 40s and 50s, so we actually showed, at least psychologically, that these people, at the end of a year of 50 hours of training, it's not very much, actually practiced differently and were different. They actually underwent some kind of major personal transformation. So this is proof of concept, if you will. Not every physician is going to sign up for a 50-hour course. But we wanted to show that this was actually feasible. It's actually possible. We don't know what the dose is. There are all sorts of questions that have come up as a result of this. But it's both a one person at a time activity, and also a culture shift in medicine. At our institution and many medical institutions now, people know what the word mindfulness means. Well, that's a step. You know, if you have a medical staff of 2,000 and they all have some kind of positive valence around this thing that we call mindfulness, and I think we've achieved that to some degree, that's an important step. Not everyone has to sit for half an hour every morning, but at least they value those qualities of mind that we're trying to cultivate. So it's, please be in touch if you want more information about what we're doing. We've got a website, the web address is there. And also, I guess, you know, to restate the obvious, it's not a straight line, okay? You know, it's kind of this, it's really a few steps forward and a couple steps back, and, but I do see movement within medicine to kind of recognize, honor, and enact practices that are likely to make care a little bit more like the dream that I had at the beginning. So, are we going to take questions now or at the end? At the end, okay. So thank you.
Thank you, Dr. Epstein. Thank you. Okay, now I will do very small technical things. There we go. There we go. I think it's turned on.
I presented at Cook-Cottone last year, and the entire thing went down, so I did my presentation by memory. So this is just, I'll wait a few seconds. Okay. We did it up kind of fun. Hopefully we won't be having that much fun right now. There we go. So I couldn't have asked for a better introduction to what I'm going to present. I'm Catherine Cook-Cottone, and I'm with the Department of Counseling, School, and Educational Psychology. And we train mental health counselors and psychologists and school counselors and school psychologists and educational psychologists and much more. The self-care imperative. Because no matter the challenges we confront, there is no escaping this reality. No matter what others or we try to say about it, if we don't care for ourselves, we'll be limited in how we can care for others. It is that simple, it is that important for you, for others, and for our planet. And that's Daniel Siegel, one of my favorite people in the world. And then from Pema Chodron, self-empathy. Our first step is to develop compassion for our own wounds. It's unconditional compassion for us that leads naturally to unconditional passion for others. If we are willing to stand fully in our own shoes and never give up on ourselves, then we will be able to put ourselves in the shoes of others and never give up on them. So you can't really see them that well, but there are lines going through this, this diagram, almost like an infinity sign. And so when I first came to University of Buffalo, I was trying to really understand things like eating disorders and addiction, and really how does the self present. And as I was presenting this model to students, someone said, have you ever heard of Marsha Linehan, and you should also do yoga? And I'm like, no. But the idea here is that the self is in the center and it's constructed. So I had read Bronfenbrenner and all the ecological models, and I felt like putting the self in the center wasn't the way it was. It left you so the very center of everything that's happening to you. And I thought, when you're making big change in your life, you're happening, you're creating, you're at cause in your life. You're at the center. And so here we have on the inner self what's in here, right? And your external system out here, your microsystem, your family, community, culture, out there. And who you are is out here. So there's in here, out there, and we're out here making it happen. And you're constantly constructing who you are. I'm negotiating my internal self, right? Here. So all of my, while I'm up here, my physiology, I know my hydration level right now. I went running this morning, right? I can feel the sugar levels in my body. I can feel a little anxiety. I'm feeling my emotions. I'm also thinking. I'm thinking and I'm creating an attuned experience of self so that I can articulate to you out there what's happening, right? I'm co-constructing right here. And my external self, all of this, right? So, and they could be disruptive. I could have ineffective communication patterns that impair my ability to have interpersonal interactions, right? I can have an alcoholic parent. I can have a really dysfunctional hospital for which I work, right? So all of these systems, with eating disorders, we have a media obsessed with thinness, right? So there are all these things in the external world, our economic system, our education system, the political parties, right? So there's a lot going on. And so we're constantly in the creation of who we are. So as we manage our internal and external aspects of the self, this quality of attunement we have with the inner and outer experiences can change with any experience, whether internal or external. So for years I tried to validate this model, and then it hit me, it's self-care. Like self-care is the thing that allows you to really create and cultivate attunement and integration between your inner world and your outer world. It's this actionable set of practices that can keep you steady while you negotiate and are at cause out here, right? So it's this interdependence and you're creating it. So self-care, the daily process of being aware of and attending to your basic physiological and emotional needs as you shape your daily routine, your relationships, right? And your world. So Norcross and Guy, coming from Pennsylvania, say that it's actually an ethical imperative to be in self-care if you are in a self-help practice. We gently urge you to challenge the morality of self-sacrifice at all costs, to consider the indispensability of self-care. So we looked at American Psychological Association, American Counseling Association, American Medical Association, all of these bodies in their professional standards address self-care as an ethic. So busy cutting wood. A woodcutter strained to saw down a tree. A young man who was watching asked, "What are you doing?" The woodcutter replied, "I'm cutting down this tree." The young man was unabashed. "You look exhausted. Take a break, sharpen your saw." The woodcutter explained to the young man that he had been sawing for hours and he didn't have time to take a break. The young man pushed back. "If you sharpen the saw, you would cut down the tree much faster." The woodcutter said, "I don't have time to sharpen the saw. Don't you see, I'm too busy," right? The paradox. Many of us never really learned how to take the time to care for and nourish ourselves, having been trained to believe this would be selfish, not having most helping professions taken the time to develop a compassion for themselves and a compassion for their own wounds. So we begin with self-awareness and self-monitoring, right? And I'm in one of the busiest months of my life, and I'm telling you, I teach yoga, I also teach at the university, I'm a researcher, and I'm presenting at conferences. I'm taking, I think, 10 airplane flights this month. And I tell everyone, I'm like, I am going to be a model, like a real supermodel of self-care, because I'm not getting sick this month, and I will practice yoga or go running and meditate every day. I'm doing that, even though I'm going to be very, very busy. And why? Because I'm at cause in changing this world. And I need to be a healthy example of how that can happen. If I show up hungover, because I had to have 4 glasses of wine to get through my day, right? And scattered and looking like I was sick, and I wouldn't be a good ambassador for self-care, right? A good ambassador. So we are, as helping professions, ambassadors for self-care, ambassadors for mindfulness. So in the center, what could we be at cause for is this embodied self-care. You have to do it, it's actionable. My colleague, Dr. Wendy Geiker, who's sitting right here, and I created the Mindful Self-Care Scale. And we did that because there was no psychometrically sound way to measure self-care. There are a few scales out there, but they were essentially items and sets of practices, and so we wanted to create this psychometrically sound measure so people could really see, what am I doing? It's available short form and long form on my page, and we have it submitted for publication right now. We've done the exploratory factor analysis and early validity studies. So it should be available as soon as we get it accepted without revisions, immediately, anytime. I'm just kidding about that part. So we explored these items. Oh, it was exciting. I was sitting writing at home, and Wendy was at UB here, and I'm trying to get my book written, and she's trying to get her research done. And all of a sudden I get an email, and it's somebody asking permission to use our scale. And so I'm like, oh, that's so great. And they're like, oh, I work with doctors. I go, that's nice. And then I scroll, I'm like, I wonder where they're from. I'm like, oh, the Mayo Clinic. So, you know, like, I used the dating rules. I had to act like I wasn't too excited. So I call Wendy. I'm like, oh my God, the Mayo Clinic, what's your scale? I'm like, so tomorrow around 2 p.m. I'll respond, right? Like, hey, good to hear from you. Yeah, you can use our scale. It's cool to us. No, I was more professional, but super excited. So they are actually using it with their residence program right now. And so we'll find out how all that went. And of course, we offered to help them analyze the data, whatever they need to make that happen. So here they are, our 6 factors, 33 items. We started out with 84, so it was like kind of really difficult to give up items. So one thing that came out, and this factor held together the whole time, supportive relationships, really important. So here are the items. I spend time with people who are good to me. I schedule, plan time to be with people who are special to me. So it's really important, it's not just any people, it's nice people and special people. If you spend time around mean people, it doesn't work as well. I felt supported by people in my life. I felt confident that people in my life would respect my choice if I said no. Really important, right? Especially if you're a caregiver and a helper. I felt that I had someone who would listen to me if I became upset. Supportive structure, and so we just heard about this. I kept my work and schoolwork area organized to support my tasks. I maintained a manageable schedule. I maintained a balance between the demands of others and what's important to me. And I maintained a comforting and pleasing environment to be in. Mindful awareness, so we heard about this. I had a calm awareness of my thoughts. These held together through every single, Wendy and I were when you're working with analyses on the computer, you press the button and everything that you love gets just like brutally analyzed by the statistics. And so we were like, oh, they stayed together. So these hung together really tightly the whole time. Calm awareness of my feelings, calm awareness of my body, so the whole internal side, right? And I carefully selected which of my thoughts and feelings I used to guide my actions. Super mindful. Mindful relaxation. So here, I'm not going to read through them all, but essentially all different ways to take care of yourself. Physical self-care. So drinking water held solid, eating nutritious foods, planning your meals and snacks, exercising, taking part in scheduled activities, right? And we know that scheduling pleasant events reduces depression. So the idea of actually scheduling your activities, and I can tell you, like when I'm doing yoga and when I'm running for the rest of the week right now, I know exactly when and who with almost, right? So I planned these things, and I practiced yoga or another mind-body practice. So this one we couldn't understand. This one was like super tricky. We're like, how come these were separate scales in the 84 item? And so what I realized is that these are a little bit like, if you've ever heard of grit, it comes from UPenn and it comes from Seligman's Positive Psychology, Angela Duckman. It's actually mindful grit. So grit is more like long-term goals, and I'm gonna dig in, but that makes me a little nervous because medical students, doctoral students in psychology, we dig in until we have some kind of debilitating cold that we can't get out of bed and literally shut down to stop trying, right? So grit, I like grit, but grit has a little bit of a risk of running us down. And so what I realized is this is mindful grit. So it's not long-term goals, it's purpose. That you have a sense of your purpose, right? Like, why am I doing this? So when everything gets tough, I go, like, lose a patient, right? What am I doing? And you know what you're doing. You know why. It keeps you going, right? And then the other one is self-compassion. And gosh darn it, Catherine, like, sometimes you're gonna screw up. And I love you anyway, right? One of my students in my yoga class said, how come when I screw up I say, Catherine, you're trying so hard? She goes, I don't use my own name, I use your name. Because I use my name for examples. I go, that's good, you're helping me. So those are essentially a self-compassion component and purpose. So we're kind of calling it mindful grit, but we're keeping our title. And then we kept, these are the ones that factored out of the scale, but I couldn't give up, so we created a clinical scale. Wendy, my colleague, let me do that. She goes, okay, you can have a clinical scale. So these are the ones that meant a lot to me, but they didn't hold together in the factor analysis. And then we have general ones. So just looking at, I don't know if you want to kind of look at these, but these are the great gratitude, pleasant events, deep breathing, meditation, resting, and not enough sleep. So those I thought were so important, we'd keep them in the clinical scale. And then our general, just are you creating new ways of thinking about it? So here we have your mindful self-care, and they mapped onto my model really nicely. So you have your physical care and your self-compassion and purpose that help organize your inner self. Then you have, on the outside, your supportive relationships and supportive structure that this just happened. I was sitting one day and I called Wendy again. Wendy, they map onto the model. I'm sure she sits and waits for my phone calls. Supportive relationships and structure. And then in the center, the out here, right, is mindful awareness and mindful relaxation, where right in the moment, you're making it happen. And then how we do this is just as you become aware, right? You assess what's going on. You choose the things you need to bolster. You do them. You engage in these practices, and then you can re-up. And you can actually retake the self-care scale over and over and over and watch. And in my self-care and service class, we actually have the students do that through the whole semester and write a paper on how it's evolved. So take a moment and think of all those domains and choose one. Like even if it's just one, right? And make a commitment to do something once a day that's on that scale. Just one thing. If it's just going for a walk with your dog for 30 minutes, your life will literally change with just one. And there's 33 plus this clinical scale that you could do. You could 33-fold change your life.
Next set of slides.
So the next thing I'm going to do, and I can start talking now so that Mia can get up here. So while I've been working at the university, I said, how can I get this into the curriculum, all of the mindfulness stuff? And so somebody was asking earlier, how do we do this? How can we change the institution we work in? Well, I was doing this all by myself in a department that I was the only mindful person. So I said, I'll just start teaching one elective course. And then I added another one, and we had a lot of changes in chairs and things like that, and so I started making this happen. Before you knew it, guess what I did? I created an advanced certificate that I submitted to the state. Thank you, Katie darling, wherever you are. So this is an actual registered advanced certificate for anybody in the helping professions, and I have an audiology student and a law student here to talk about, so I picked kind of some students who are doing an atypical, it makes sense for mental health counselors and doctors, but it makes sense for a lot of fields. So we said, this mindful counseling, it can take whatever you do and make your interaction with the patient even more powerful. So, and I have the list. Psychologists, social workers, mental health counselors, school psychologists, school counselors, administrators, lawyers, teachers, OTs, PTs, speech and language pathologists, audiologists, MDs. So when you graduate this 5-course sequence, you leave with an advanced certificate in mindful counseling. So we know that, and you've just heard and you're going to hear all day, so I won't reiterate, but that these practices are helpful, and if you can embody them as a practitioner, you will be an ambassador for those practices. So here's the description just briefly. It's a 15 credit hour sequence of courses to provide foundational knowledge and then techniques. So we have the Mindful Therapist, which is based really on Daniel Siegel's work, and you learn how to be exactly in that space of paying attention to your patient anew every day. And it could be your patient, your client, the children in your school, the children in your classroom, the teachers that you administer, all of that. It's like you create presence in your current present moment. And then we have a class, evidence-based interventions. So, and Dr. Geiger actually teaches that course, where you learn all of the evidence-based and the research in the field. We have a coaching for health and physiological integration. So this is really taking the model that's kind of come around in the more popular, I guess, secular world, the non-academic world, too, of the coaching model. So it's how to use coaching strategies to encourage medical compliance, to encourage mindful self-care behaviors, and you learn the research behind that. Did I do that? See, look at it, it's what I do to this. This is what I do. This is not the first time this has happened to me. So I know it by heart, though, it's okay. And then there's a course, Yoga for Health and Healing, and that course, in all of these courses, it's part practice is required, and part learning. And so you have to embody what you're learning. So in the yoga class, we move the tables away and we do yoga for an hour of every class, and the students have done this. And then the last course is service and self-care. So you do an active service learning project, and you are an active self-care. You can sub out one of these classes as an elective, so like the law students have their mindful law class that they can use as an elective, so you really only need 4 courses and 1 elective. The social work students have trauma classes that fit nicely in, so if you didn't want to take the yoga class, you could do an elective. So that's essentially the program, and you end up with an advanced graduate certificate from New York State. And then I have 2 students here that are going to share with you briefly their experience.
My name is Canale. I am a 3rd-year Doctor of Audiology student here at UB, and really got into mindfulness and yoga practice within the past couple of years, and I found out there was a certificate starting in UB about a year ago, and I knew I wanted to be a part of it. And I'm just going to describe a little bit about some of the 2 courses that I've taken so far, as well as what that means for me and my future as an audiologist, what I'm currently doing at UB, and my own personal identity. So, the Mindful Therapist course, like Dr. Cook-Cottone has briefly just described, was an introduction to mindfulness and how to be mindful, how to be a therapist, and combining those. We came up with our own definition of mindfulness. We all know what it means, but what does that mean for us? How are we truly mindful to be in this present moment, to let go, to have self-care, to find it for yourself, with practice of every class having lecture and then going into yoga and embodied practice, to also be doing books, reading Buddha's Brain, and writing a little reflection piece on that, and having discussion on the neurological inputs that we get. Very awesome book, if you want to read that. And also using the mindfulness-based stress reduction workbook, which you follow along on your own. And it was a 10-week kind of setup, and once a week, you make the commitment to read the book, follow along, do the exercises, and it really coincided really great. And along with that, we had required, unfortunately, not really, yoga and meditation relaxation minutes to require every week. So you really can't beat that, and journaling, and that really reinforces and to be accountable for the practice that you're doing. And you can't be in the moment, you can't be mindful unless you are embodying it and doing it. So having that, I had like the least stressful semester of my life. It was crazy and still just as busy, but it's amazing how using mindfulness and using meditation and using relaxation, and so focusing on self-care, because that's another course, self-care and service, makes such an impact. You're still doing what you've always done, but maybe you're doing it even better, and maybe you're even more passionate about it than you thought you were before. So self-care and service, with everything that Dr. Cook-Cottone talked about, using the self-care scale, we did it about 3 times. We did assessments. We also had to do a service learning project, going out in the community or our world and being able to do some self-care. So we had our active practice, finding that foundation in ourselves first, understanding burnout in our profession. In audiology, not heavily researched, however, burnout is prevalent. Burnout, I'm sure, is prevalent in every vocational field. And understanding why we need self-care to prevent that so we can be more effective. So with our service learning project, we wanted to bring self-care to the community. I ended up having the opportunity to go to Brazil and doing a humanitarian trip, contributing to making hearing healthcare access possible for underprivileged communities in the Brazilian Amazon basin. We don't always think, when we think of self-care, as vast things. This really focused on bringing access and bringing justice to people who have never had a hearing test in their life. People who have been deaf their whole life and had no idea that they were deaf. So bringing that to them was incredible, and then also for me, learning to still have self-care while I was down there. You know, I'm traveling, I missed a week, 1 to 2 weeks of school in the middle of my semester, trying to stay on board and stay effective. So it really was an amazing experience, and we all the students in that class had to do their own type of project, and we've all saw the impacts of that, and I'm sure it's not just going to stop here. We had goals and made goals for that community in the future and made goals for ourselves in the future. So moving on, just about my applications and aspirations. Since this, it really ignited me to start a research project at the UB Speech, Language, and Hearing Clinic. There's patients who have ringing in the ears called tinnitus. Many of you may have it right now. It may be a chronic ringing, or you may experience when you go to a loud concert and then for about an hour or two later you have a chronic ringing in your ears. For some people, it is correlated with anxiety and depression, high stress levels, and there's actually been a mindfulness-based stress reduction for tinnitus program that has been created and researched, and we're one of the first institutions, if not the institution, that has taken it from its original pilot study by Dr. Jennifer Gans and going to start it at UB. And it's in the works. We're starting the IRB protocol to get that submitted. We have a bunch of students working on that for their capstone research project, and we are going to be implementing it to patients. So it's really exciting to know that mindfulness does have a place in my profession, as well as once we take it from this research study, it can be a set program, but also with our other patients. Those with hearing loss deal with many other issues, including grief and denial and not being able to be an advocate for themselves about what hearing situations that they need. There's a place for mindfulness in that with audiologists, but maybe right now audiologists don't know that or don't utilize that fact. Parents of children who have hearing loss, a lot of other issues there. Having mindful parenting of those with developmental disabilities has been heavily researched, but there is a place for that to be with those who have hearing loss, cochlear implants, or hearing aids for the pediatric population. So really using hearing amplification as a tool instead of a handicap, changing our view. Hearing loss, or what's going on with their hearing status. How are they helping themselves? So really for me, it's been discovering how to be a mindful audiologist. Having my 3 main areas that I've really been focusing on are having compassion for myself and others. Being in grad school, super organized, super type A, have to be really self-critical a lot, so you have to remember to have compassion for yourself, to have awareness without judgment, and impermanence and equanimity. So really to better develop myself and to ultimately develop into a mindful therapist that is truly present and open and effective in helping my patients is what I really aim to do. This image is from my vision board that me and my roommate did earlier in this year, just a section of it, of my audiology and my professional career. And it's just exciting, and I'm very grateful that this is an opportunity, and we are all here to really gain from each other. So thank you.
Hello, my name is Meghan Kelsey, and I'm a third-year law student at SUNY Buffalo Law. So I started taking the classes for the certificate program, and the first thing that really stood out to me was this model that comes from Dr. Cook-Cottone's book. And in the law, I noticed that there's kind of a dichotomy presented between reason and emotion, where the lawyer is supposed to embody reason and rationality above all else. So there's a lot of emotion work in that, if you look at kind of sociological concepts of managing the emotions of your clients, projecting certain emotions that you want onto the jury, onto the judge, and working within fields that are inherently emotional. With family law, you have child custody, you have divorce. Criminal law, you have victims, their family, people accused of heinous acts. Wills, trusts, estates, you have someone's final word on where they want their property to go, who they want to benefit. Tort law, again, you have victims. And interestingly, they're finding with tort law that a lot of times the victims want an apology. And that's not something we can monetize, which is very interesting because that's emotion. But yet, we still have this sense of the lawyer not putting their emotions into it and being able to control and contort emotion. So with this little diagram, we see that over-reliance on thought and over-reliance on emotion is not creating an integrated and effective person. That ultimately, in the middle with equanimity, you allow for presence, connection, and intentional action. That's where you're productive and effective. So through mindfulness, we can find this area for ourselves, create that space, and be actually more objective, because you can notice and see the person for who they are, see your client for who they are, the whole story. You're not projecting your bias into it, your own emotions, and you're just more aware. So when we look at lawyers, we used to think, when I first started law school, about a quarter have an issue with drinking. The latest study that just came out is saying it's more like 1 in 3, with high levels of depression and anxiety in the field. And this is a lot higher than most other professionals. So it's a great area for research if anyone's interested. And my thinking on it, my hypothesis, is that a lot of this comes from splitting emotion and reason. So not paying attention to your own emotion and just staying in that rational, this is what we do. You know, you look at Supreme Court decisions and they'll say, poor Joshua, well, the facts of this case are compelling. The law is the law. And that's really hard to say. And if you don't acknowledge that for yourself, that you really wanted to help Joshua out and this stinks, you're gonna take that home. And you're not gonna feel your emotions as much at home. And then maybe you turn to something else. And with lawyers, there's also a sense of not wanting to reach out for help because it means that you're not effective or you can't do it. And so with mindfulness, it's a way to present an intervention that you can do anytime, any place, and no one has to know. You can sit at your office, put a little red thumbtack on the wall, and meditate on that thumbtack for 5 minutes, and be more effective when the next client walks in. So my favorite quote is, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So through mindfulness, through yoga, meditation, breathing techniques, walking meditations, we're able to dig into that space and we're able to choose our response. So it's about being flexible, adaptive, coherent, energized, stable, there for your client, holding compassion for them, and also just recognizing all of the complex issues that are in everyone's lives. The law is inherently a human thing. We've got emotion in it, and we should recognize that. And when you look at negative bias and how we're all very self-critical, it's kind of an evolutionary concept of those berries were bad, so I'm going to remember not to eat those berries and get sick again. And then we take lawyers and we teach them to look for everything that's wrong. So you look at a contract, and instead of being like, oh yeah, this looks good, 2 friends entering into a business, everything's going to work out, we're like, did you see that clause? oh no, what if her dog does this and then that happens and then all of a sudden you're trying to get out of it and this clause says you can't do that? And then you start doing that in other areas of your life where you're looking for the exact thing that's gonna go wrong. That no one else sees, but now you're trained to look for it. So we can kind of take a step back and reintegrate ourselves. So I plan to use mindfulness in my own career to prevent the burnout, all of the different mental health issues we see, substance abuse issues, but I also really want to use it as a resource, both for my clients and for my fellow colleagues. So I want to be there for my clients. I want to see them as real people with real problems, not as black letter law. And I want to be there for my colleagues, be able to kind of work through it with them, recognize that they're emotional human beings, and speak to them with respect.
Thank you, Meghan. I'm going to move over here. Comments, questions. Thank you so much to our panel while you kind of get your thoughts together. All right, well, if we don't have anybody ready, oh, no, we do. I thought I was going to get my question in.
This is for Dr. Epstein. I am from Roswell Park, and we're starting to bring mindfulness in, training in for our patients. And of course, we should bring it in for our clinicians as well. But what do you think about offering in a setting, both for the provider and for the patients, mindfulness training? Have you done that in a setting in Rochester, and was it effective?
Are you referring to having them together in a
No, but I think we're trying to come up with a new model, or a model for our institution, and we will be offering things separately, but I just wondered if you had that experience, because we do want to empower patients to come into a setting like a cancer diagnosis with an increased self-awareness as well. And I just wondered if you had experience with that.
My own work has really been with health professionals, but my partner, Mick Krasner, has done quite a bit of work with patients, and there are other programs available for them. And early in my career, I actually would teach patients to do meditation as part of my clinical practice in family medicine, but the world changed, and appointments got shorter, and so it really became impractical to do that. But my passion is really working with health professionals. I mean, there are many, many programs for patients where they can learn a variety of self-awareness, mindfulness techniques in medical centers around the country. So this is nothing unusual anymore, fortunately. But I wouldn't be able to advise you how to start that kind of initiative. Doing them together, of course. I mean, if you have health professionals who are respectful, understand, and engage in mindfulness practices, it'll affect the care that they provide, but also it may help them direct patients towards things that they find valuable. So, yeah, they go hand in hand.
I just wanted to add, you may want to look at Linda Carlson and Michael Spica's work out of the University of Calgary, who've done, probably for decades, work with patients within a cancer center and published research on that. So it may provide some background and backbone for you to initiate this with your patients at the Cancer Center at Roswell.
Another branch of my work is a not-for-profit that I founded called Yogis in Service. And so what we do is we provide yoga to people who wouldn't otherwise have access. And we're just started a program with Children's Hospital and with the oncology arm of the hospital. And so we're going to be working with kids there. So if you want to reach out to me, if you're interested, yoga isn't just the asana or the postures, it includes meditation and relaxation, because we're interested in working with the hospitals in the area.
I would also add there's Kula for Karma, which is a national organization that works with a variety of folks around engaging in mindfulness for better health and resolution of a number of things. And they specifically have a cancer arm. Oh, come on, we have at least 5 more minutes. I could make you meditate before lunch. No, I got somebody up here. To be fair, I actually saw this person first, and then we'll have time for you. Thank you.
I don't know if this can be answered in 5 minutes, but I have a real question about, well, just to put it in context, I practiced law for almost 20 years, and I did find that there was a huge disconnect between my emotions and being logical and being a good attorney. And I'm just wondering how you teach. How do you teach to observe and to be empathic and to be compassionate, but still have the ability to separate and not become what it is that the other person is feeling?
That's mindfulness. So it's in act therapy, they call it diffusing, right? And so it's the ability to be more, it's like you become the witness. So instead of, and our language shows it like, I'm angry, I am angry. Like I'm Catherine, right? And then things happen and I feel anger. So it's subtle, but it's that you become this witness that then and you're aware, like, and you're feeling it. So and my students, we go back and forth as they argue, like, you're gonna become like a robot and you don't feel anything. And it's like, the yogi in the cave right? And it's not that at all. It's that I'm deeply feeling in this moment, like the idea of the doorknob, and I'm with this patient right now, right? And I am feeling it, but I'm not becoming it, right? So the idea of the emotions, they move through you. Emotion, it's like moving through you, and you don't have to hold it. So the sense of impermanence, everything arises and passes away. Non-attachment, I'm not it. I'm feeling it, but I'm not it. And it's a practice, so at first it's complicated and it's fused. You are angry, if you are right? It feels like that. And then in the practice, you gain the perspective, right? And you'll even notice, doesn't mean you'll never get in it. I have 2 teenage daughters, I get in it. And then I'm like, oh, I'm in it. Or my husband's like, I think you're in it. And then you're like, oh, and I have the skills to reorganize, right? If that makes sense. And then and that's why you practice on your mat, you're in plank pose, and you're in plank pose, right? And then I've learned the most valuable things in my life, in plank pose, because I used to be plank pose and in great drama in my head over plank pose. And then one day I was sitting there and I was like, what is really happening right now? I feel my thighs, right? I feel my belly, I feel my hands, and actually none of this is all that bad, right? And it was like this, oh wait, and where else do I do that in my life? I love this 17-year-old in front of me so deeply, and I'm scared about the decisions she's making, right? For my daughter. And I have a beautiful daughter. And shifting from I'm scared to I love you in my thinking, I love her. And then listening to her tell me her own fears instead of me getting scared, I'm now in love and listening. So it's a practice. It's like a practice, and it's possible. It's possible. And it doesn't feel like it when you first start. You're like, I'll never be able to unfuse that. And trust me, that's the practice. So it's like I say, self-care is a practice, self-love is a practice, love is a practice. If that makes sense.
And then, I don't know if it's helpful, but I've challenged Catherine a little bit on this kind of stuff before, just especially with okay, but what if my client is really just a bad person and I don't like anything they've done, and now I have to like do stuff for them? And she challenged me to think, well, you're an advocate for that person. You don't have to take on their acts, their emotions. You can recognize that they're a whole person themselves. They've done bad things, they've done good things. And you're really there to use your voice for them. And I think that was a very helpful way to think about it.
Thank you. We have time for this one last question.
There are a group of public charter school principals in Rochester who want to bring mindfulness to both our teachers and our students. We haven't been able to get traction, busy being a principal. Is there a resource in Rochester that any one of you would know who could help us lead this effort?
I didn't get all of your questions. So you're a group of...
I'm associated with a group of principals of public charter
And so
schools.
you'd like
in
to
Rochester.
begin doing some kind of mindfulness activity amongst yourselves?
For our teachers and our students.
Yeah. Why don't actually, that's kind of a very specific question, so why don't you just come down afterwards, we'll brainstorm. Gotcha. But thank you.
And next week, we're getting ready to go to the Yoga in the School Symposium at Kripalu, where people from all over the country meet to talk about bringing yoga to their schools and all the challenges and the programs. This will be the 3rd annual conference. So that's another.
Yeah, they're an excellent organization. There's also a corresponding mindfulness in the schools. I believe that is the time that we have. I want to thank you for your generosity. I want to thank the panel for their generosity. Breathe deeply and enjoy the rest of your day.